Hello, friends. I'm Dr. Ankit Potdar. So, today we are live for a very good cause because I want to elaborate about everything about bariatric surgery. So, overall, it is all about weight loss treatment. So, can we see how many people are live? How many people are there? Um, okay, friends. So, I think we should start now. So myself, Dr. Ankit Potdar, I'm a laparoscopic and bariatric surgeon from Mumbai. So I'm working in multiple hospital, but mainly I'm working in SRV Hospital, which is based in Goregaon and Chembur. So we are the very highest volume center for bariatric surgeries. We have treated almost 2 to 3,000 people yet, and we have transformed their lives. So this is today's session all be about just educating everyone about weight loss treatment, because there are so many things that a lot of people get scared of surgery, or most of the people don't even know how this bariatric surgery works, whether it's a permanent weight loss or whether it's a temporary one. Because a lot of people nowadays they try to take a very basic program for weight loss. Some goes for ayurvedic, some goes for herbal life treatment, some go for some different type of diet like keto diet, intermittent fasting diet. Lot of diets people follows, but ultimately what happens, they try to sustain their weight for some time. Hello. Sorry, guys. I just took a little break because I think we should wait for some more people to join. But anyway, so today I'll be speaking about the overall thing. So what I was saying, that a lot of people follows a lot of diet, but still, for some period of time they try to lose some weight, but after that they, somehow they again regain their weight, or somehow they lose their motivation about losing weight and all the stuff. So basic, idea behind weight gain and weight loss is very basic things. Is all about how much calories you are in taking and how much calorie you are burning. So this is the only main basic funda behind weight loss or sustainable weight, you know, like that. So before that, so before going for talking about all about bariatric and weight loss, before that we should understand that what is a actual formula to calculate whether any particular people are overweight or obese, or they are normal or they are underweight. So there is very basic formula called BMI, which is normally available on internet nowadays. So the formula basic consists of your height and weight. So you just have to put your height and weight, and you'll come down to know what's your exactly BMI. So if you can see on the screen, if the patients are normal BMI, who are tend to be fit, so their normally BMI goes somewhere around 18 to 25. So if your BMI in between this, you may consider yourself as a fit or a normal BMI person. Let's say we'll talk about that if suppose the BMI is less than 18, okay, or less than 16 or 15, then you are completely underweight. There are so many people in this world, they are underweight because of their, again, metabolic problems. But today in this session we'll only discuss about overweight people, right? So whoever BMI is about 25 to 30, we consider them in the pre-obese group. Means they are just gaining weight, and there is lot of good opportunity for them to lose weight only by doing diet and exercises. Okay, but we'll see today about the people whose BMI is above 30. So we call them in the obese category. So again, in this obese category, there are another three classes. If the BMI is above 30 to 35, they are in obese class 1. Who are in 35 to 40, they are class 2 obesity. And who are on above 40, they are obese class 3. Okay. So now we'll just consider what will be the treatment for obesity. So as I told you, who are in the pre-obese group, means the BMI is between 25 to 30, they have a very good chance to lose weight only by doing diet and physical exercise. They don't need any treatment, they don't need any drugs to lose weight or anything, just pure diet and exercise. So diet means the lot of high fiber diet and high protein diet, and less of carbohydrates and less of all processed and junk foods. And normally have a tendency to eat less so that there should be a calorie deficit in your body. And somehow, if you increase your physical activity, it will the energy will get drained out and you start losing weight. So this is a very basic idea for those patients whose BMI is between 25 to 30. So let's say about whose BMI is about 30 to 40, and let's say BMI above 40. So then there are multiple options we have. One is we can try to give them normally. Nowadays there are so many drugs which there is some which can give you a weight loss. And eventually there are non-surgical option and surgical option for those patients whose BMI is above 30 and 35 or beyond 40. So we'll discuss about this. So now the basic is why to treat obesity. The first of all, because if you think only, okay, I just want to lose weight and so that I should look fit. So there are not that very easily we can lose weight, because there are so many associated problem are associated with obesity. So first of all, there are too many diseases which can occur because of obesity. So let's just concentrate on our cardiac point of view. So whoever are obese, whoever BMI is above 30, they have a high tendency to develop hypertension. They have a tendency to develop pulmonary hypertension. They have a high tendency to develop DVT. They have a high tendency, they may get sudden cardiac arrest, sometime even sudden death can be happen in obese patient. So these are all cardiac problem may occur because of obesity if you ignore it. Another is the respiratory, means let's say about the lung related problems, that whoever snore in the night, whoever are the obese patients and who have a tendency of snoring, we call them as a obstructive sleep apnea, and that's also one of the life threatening problems. Okay, so then there are another what we call normally to all obese patients called metabolic syndrome, because once they become obese, there are so many hormonal changes occur in their body, and that's why we call them as a metabolic syndrome. And again, because of obesity, they have a tendency to develop diabetes, type 2 diabetes. Sometimes if the obesity is very prolonged and if they have a fatty liver, they may become they come down to a cirrhosis of the liver. It's called NASH, non-alcoholic cirrhosis. Then there are another problems which occurs on digestive system. Because of so much of obesity, they have a tendency to become acidity. They are have a tendency of indigestion because of obesity. And one more important thing, that they get gallstone because of obesity. So these are also very common in older age group, or even in nowadays we can see in very young age. Because of obesity, they get lot of muscular problems because too much of weight on their knee. So they get degenerative joint diseases, because most of the people complain ki ki pain bahut hota hai knee mein, and they can't walk, they get too much of pain while even taking few steps. So though this is all because of degenerative joint disease, and this is all because of weight gain. So now we'll consider what are the recommendation for bariatric surgery. Okay, so now as I told you, we have both options. One is non-surgical option and one is surgical option. So whoever is BMI is beyond 35 without any comorbidity, let's say they don't have any diabetes, let's say they don't have hypertension, let's say they don't have any other problem, only obesity is there, and their BMI is above 35, it means they are in the category that we can consider for bariatric solution for them. Whether it's a non-surgical or surgical, we'll discuss afterwards. But let's say whose BMI is above 32, but if they have any one of the comorbidity, like say diabetes, blood pressure, or PCOD, or sleep apnea, or knee problems, or back pain, or breathlessness, then they are also a candidate to undergo for bariatric surgery. Okay. So is there any other criteria? So yes. So the we can view the bariatric solution for the age group from 16 to 65 years. Sometime we have operated to those patients who are above 72 also. But I think 72 to 75 is a limit. We should not go beyond it. Then there are very important factors that we should screen the patient from mental and behavior disorder, because some patients has this mental disorder to eat more. So before taking them for surgery or any options, we need to correct those problems, behavioral changes, so that they can get a control on their diet. There are no any absolute contraindication to any major abdominal surgery. So if you have gone any previous surgery or any abdominal surgery, so there is no any contraindication, we can still go for surgery for your obesity. The fifth point is obesity of long standing. If you are obese prolongedly more than few years, and if you are not looked after yourself, then we can consider option for you. So only contraindication for bariatric surgery is from cardiac point of view if they are very poor, if their heart is completely poor, if their ejection fraction is completely low. Another contraindication for surgery if they have chronically, if they have a lung diseases, like chronic obstructive airways. But nowadays, even for all those people, we have non-surgical option, which I'll be speaking on afterwards about the balloon bariatric and all. So, so there is no any specific contraindication for non-surgical. But yeah, if we are considering a surgical, scenario, then there are few contraindication, and those patients who are psychologically completely ill, then we should be aware. बोल देते हैं. So the So now there are three basic types of surgery which which the bariatric surgery works. One is predominantly restrictive procedures. I'll explain you everything in detail. Another types of surgery which is consumed of predominantly malabsorptive procedure, and there are third type which called mixed and combination procedure. Okay. So what are the restrictive procedures? So what are the bariatric surgery which has a restrictive procedure? So these procedure are solely restrictive by creating a small gastric pouch or a degree of outlet obstruction leading to delayed gastric emptying. So what happened because of restriction? It reduces your oral intake by limiting gastric volume. कुछ ये आ रहा है क्या क्वेश्चन आंसर? नहीं. The another is produce early satiety, because the early satiety means you feel that you feel that you are completely full. The third is leave a alimentary canal in continuity, and it minimize the risk of metabolic complications. So this is the whole and soul about restrictive procedure. So there are few types of surgeries available which considered as a restrictive procedure, but nowadays we only do two types of procedure. One is called sleeve gastrectomy, and another is a intragastric balloon, which is non-surgical. Okay, so these are purely restrictive procedures. So now let's say about we'll talk about laparoscopic sleeve gastrectomy. So this is a standard procedure for surgical management of morbid obesity. So which is very rapid and less traumatic operation. It gives a good resolution of comorbidities and good weight loss. And further, we can combine the procedure in case patients required. So what exactly is in laparoscopic sleeve gastrectomy? So if you can see on this picture, we actually cut 70% of your stomach. So what remains is only 30%, and you can see that only now a very small tube-like structure which is present, and most of the stomach actually removed from your body. So what happened when we remove this? So it gives us two benefits. So one is a mechanical restriction, because when there is not much stomach left, so you cannot eat much. So it's called mechanical restriction by reducing the volume of the stomach. And another which is very important is hormonal modification, because most of the hormones present on that part of the stomach which we remove. And when we remove that hormones from the stomach, that gives a good weight loss journey. So what are the hormonal, what are the hormones which is present on stomach? So the first of all, which is very important, is called ghrelin hormone, which is present on the fundus area of the stomach. And once we do this surgery, so we remove that chunk of stomach, so that the even hormone get removed from the body, and then your weight loss happens. So another type of restrictive procedure which we are also will speak today is called intragastric balloon. So this intragastric balloon is nowadays, it is completely non-surgical. It's just a capsule which patient needs to swallow, and once it goes into your stomach, we inflate that capsule into a balloon, and this balloon remains in your stomach for 4 to 5 months, and patient loses somewhere around 15 to 20 kg over the period of 4 months. So as you can see, it's completely non-surgical, non-endoscopy, no anesthesia. Even patient doesn't require hospitalization for this. So if you can see here, this is a balloon which goes into the stomach, and it remains into the stomach for 4 months, and that's how your intake goes down, and eventually you start losing weight. So if you can see here, once we do a bariatric surgery, so what happened once we do a bariatric surgery for those patients who are obese, and if they have so many of comorbidity. So if you can see from above, let's say if the patients are into depression because of obesity, so almost 50% of their problem goes away and they come out of the depression. Let's say if suppose some patients have migraine, so 60% of their migraine gets solved out once they start losing weight. Then we'll see about obstructive sleep apnea. As I told, if patients are snoring in the night and who are obese, and if they do a weight loss treatment like bariatric surgery, their almost 98% of snoring get resolved. Let's say if suppose some patients are asthmatic, their 70% of problem of asthma goes completely down and they improve. If suppose there are few patients who have high cholesterol levels, and once they start losing weight, almost 65% of their cholesterol goes down completely. Let's say if there are patients who has fatty livers, or almost they are into a stage of becoming liver cirrhosis, almost 40% of patients come out of that, and their liver become completely normal. Let's say if patients have hypertension, means BP problem, their 70% of BP goes down, and then actually we have to stop the tablets which is they are taking for blood pressure. And very important, if suppose the patients are diabetic, let's say and they are taking multiple tablets or sometime insulin, so almost 90% of the diabetes goes away. That's why even bariatric surgery is also called as a diabetic reversal surgery also. So almost 98% of patients, they are completely off from their tablets and they live a very normal life. Then for those females patient who has a PCOD and PCOS component, and because of that if they are infertile, almost 100% resolution is there. They completely, if you after over a period of 5 to 6 months, if you do another repeat sonography, you will come to know that there is no any there are no any signs of PCOD and PCOS. And very important, once you lose weight, your pressure on knee goes down, and once the pressure on knees goes down, obviously your knee problem also go down. Eventually even back problem goes down because of so much of weight completely fade away, and the quality of life improves in almost 95% of patients. And the risk of mortality means if it's life threatening because of obesity, so the relatively 90% of patients does very well, and their life threatening problem goes away completely. Even the gout goes completely out of the picture if we try to lose weight. So this is all about bariatric surgery and bariatric procedure. So we'll do now question answer, because we have one query from Savantagi that your weight is 90 kg and your height is 5.6. So see, if your height is 5.6, it means that your ideal weight has to be somewhere around 65 to 70. Okay. And you are almost 25 kg overweight. So if you are 25 kg overweight, so I'm assuming your BMI somewhere around 32 to 34. So if you cannot control your weight because of diet and exercises, then we have a very good solution for you. Either you can consider a bariatric surgery, or in case if you doesn't want to undergo for surgery, we have a balloon procedure also for you. So in that, you will actually you will lose almost 25 kg over the period of 4 to 5 months, and it's almost a permanent one. So bariatric surgery is also a good option for you. If you have any comorbidity like say diabetes, blood pressure, knee problem, snoring problem, cholesterol, that all will go away out of it, the picture. So any more question do we have on board? No, na? So if you want more, more information on weight loss journey or about bariatric surgery or non-surgical option, feel free to contact me, or one of my team member will, coordinate. So we'll share our number with you all people. So please, you can spread this information to a lot of your people who needs treatment for bariatric and all. Okay. So thank you everyone for joining. See you soon. End कर दो ना.